Hello, my name is Dr. Hilty Burr, and I want to officially welcome you to our first show of Your Pet, Your Vet. This is our new show that we're doing here in the area that features me and Dr. McLaren, who's a veterinarian that works with me at our satellite, which we'll be talking about soon. But right now we're at Lake Chatuge Animal Hospital, which is located in Young Harris. And this is a full-service animal hospital here in the mountains. I'm a young veterinarian, you might say. Graduated a few years ago in 1980 from the University of Tennessee. Seems like yesterday. But anyway, I practiced in Cleveland, Tennessee for a period of time. And then I actually left practice and worked in industry for Pfizer Animal Health. You may have heard of Pfizer, pretty big company. And then I came back into practice in 2005 when we built this animal hospital. We're really blessed because we have lots of other veterinarians affiliated with us and a wonderful staff who you'll get to meet. I have a wonderful wife, Susan, a couple of grown kids, and a bunch of pets. And our goal for this show is to not only introduce ourselves, but we want to help the community of viewers, pet owners, families have the best knowledge possible to take care of their pets. We're a firm believer that an educated pet owner results in a healthy pet, and that's our goal. Our motto or mission here is pretty simple. We treat pets like family. And so we work with clients all the way through from the selection phase of obtaining their pet, all the way through the puppy or kitten stage, to the adult stage, the senior years, geriatric years, and the time, of course, when we have to say goodbye, and even sometimes with the grieving process. So it's a commitment to the family and the pet. Dr. McLaren will be involved as well. He's over at the satellite at Tri-County Animal Clinic in Murphy. Lake Chatuge Animal Hospital, as I mentioned, is a full-service hospital. The satellite is just that. It's a satellite where, when early on, we started in 2005, but I learned pretty quick that I had a lot of clients over in Murphy or Western North Carolina, and it was kind of inconvenient or difficult for them to come here. So we set up a small satellite which allows them to have their pet seen and the preventative things done, the exams done. And then if they need additional services that aren't available out there, then they come here. So it's really a system that has worked very well. And we generally, with the aid of the other veterinarians that work here, who we'll talk to you about as well, there's not many things we can't take care of. And then we have a network of specialists that we work with remotely. And so we feel quite confident that we can take care of most pet health conditions. Again, we have some unique things here. We practice conventional medicine and surgery, but we also have some unique, what I would call complementary or alternative type of approaches. We'll talk about Dr. Barrett and the acupuncture that we do here. We do some pulse signal therapy, which is electromagnetic therapy. We even have a special water that we'll tell you about. So we're going to start out mainly focusing on the site today, where we are. We're going to have a little tour, show you around. Well, right now I'm standing in our lobby, and the way we have it set up, when a client comes in the door, we have a canine side or a dog side where it's pretty intuitive. We have a picture of a doggy up there, and everything's set up for our four-legged doggies. And then on the other side is the feline or cat area of the reception area. It's nice and spacious, fairly comfortable, I believe. And we don't want you to be in here too long, because then one of my goals is not take it, be sensitive of people's time. So we try to get folks out of the lobby into the exam rooms as soon as we can, so they can have their pet taken care of. We have a cat-only exam room, and the reason I feel strongly about that, cats and dogs don't typically get along really well, particularly if they don't know each other. So we're sensitive to that, so we have a cat-only exam room. It doesn't have this, although we disinfect, and veterinary hospitals should disinfect between patients. The senses of dogs and cats are really strong, and they can smell. And so I feel strongly that they can pick up on the odors of dogs, so we try to keep that area very cat-like. And then the second room is for small dogs. It's a similar room as the cat room, but it's geared towards small dogs. And then the third room is for larger dogs. It has a lift table that's available that not only helps our back, but sometimes the pet prefers to be lifted up by mechanically as opposed to being picked up and forced on the table. So that helps them feel more comfortable. We have a full pharmacy, very similar to a human pharmacy in that regard, if you can imagine that. but of course everything's geared towards pets. Then we have a large action room area. I like to call it that because it's a multi-functional room where we do dental cleanings, including dental radiology. Oxygen and anesthesia is actually piped into the room from a central area. In the action room, we also have the lab facility or the lab area. Now, we have an in-house lab, which means we can do blood work and other diagnostics right here in the hospital. We also use a reference lab. So there's some testing that we have to send out for a reference lab to help us with. However, it's important to be able to do immediate testing, particularly when a pet is very sick or an emergency situation. Also, we do a lot of tissue preparation. Say if we have to do biopsies, things like that, we do that in that area. Off of the action room, we have a radiology room where we do digital radiology, which is really the only way to go now because the technology has gotten so great that you can do all of this electronically. I remember the days when things weren't so convenient as they are now, and I really enjoy the digital radiology. It gives us a lot of diagnostic tools. We have off of the action room, we have an ICU area, intensive care unit. This is where pets who are critically ill go into. This is important because we can have oxygen in that room. Also, we can administer IV fluids and other IV products, blood, for example, or serum or plasma. And so this is done in the ICU area. This is where pets go after anesthesia, so we can monitor them closely to make sure they do okay. And then still off of the action room, we have a surgery suite. This is a sterile room where it's dedicated to surgery. We have a heated table, of course anesthesia, anesthetic machine, the monitoring equipment that's very important. The best way I can describe it to you, it's just like it is in people. We are able to manage their blood pressure, their heart rate, their oxygen levels, their CO2 levels, and make sure the pet is not having any complications while under anesthesia. So that's all done in the surgery suite. As we progress further in the building, we have a ward area where we keep pets when they're either boarding or hospitalized. We have a feline-only ward, which has a window with a view. I'm a strong believer, again, that cats are special, so they have to have a special place. So we have a feline-only ward. We have a small dog ward, which is inside ward adjacent to that. And then we have a nice spacious runs in the very back for the larger dogs, which need more room. We even have an exercise pavilion on the property, which is an enclosed area where we can let dogs off leash so they can romp about and have a good time. I do strongly believe the boarding experience needs to be a good experience because pets would rather be at home, so we try to make things as much like home as possible, and our staff understands how important that is, and the compassionate care that's required to take care of these pets is an ongoing emphasis here. That we have a dedicated grooming area, and we'll also show you the bathing area with a nice tub and a drying area. So that pretty much completes the tour, and as the show progresses, we'll give you additional details. Okay, now we greatly appreciate your time and really thank you for being with us on the tour today. And again, we hope that you'll become regular viewers, because I can assure you that our goal is not only to show you some things that you maybe didn't know, but we want you to enjoy and be entertained. And again, thank you for being with us today on the tour.